Hi everyone, today let's talk about something called urinary bladder diverticulum, and let's define what urinary bladder diverticulum is. It's an outpouching on the wall of the urinary bladder. And what happens is there's a breakage, there's an opening in the muscular layer of the bladder, of the urinary bladder, and sometimes urine flows into this opening and then forms a pouch where this urine is trapped. So what are some of the symptoms? Just to tell you that maybe you might be suffering from the urinary bladder wall diverticulum. One could be frequent in urination. Two could be chronic urinary tract infection. Three could be low abdominal pain. So when you have some of these symptoms, you could be suffering from this problem. When you go to the hospital, your doctor might decide to send you for an ultrasound. And what do we see on ultrasound? One, you will just see the bladder, which is an hypoechoic structure, but beside it, you will see a pouch. You will see an outpouching structure just connecting itself to the bladder. And sometimes you might not see this when the bladder is full, but when you tell the patient to go urinate and come back, then you might be able to see urine trapping itself into this pouch. And this is the time when now you will say that this patient could be having a urinary bladder wall diverticulum. And what are some of the causes of urinary bladder wall diverticulum? One could be enlarged prostate. Two, it could be because of trauma. Maybe you have had an accident or some trauma on the lower abdominal region, or sometimes maybe you have had surgery. Sometimes these surgical procedures could end up causing urinary bladder wall diverticulum, or it could just be congenital. Congenital means that you are born with it. So when you're having some of these symptoms, kindly visit your healthcare provider so at least we can do some of these tests. We can do an ultrasound scan just to check if you have a urinary bladder wall diverticulum. Not always when you have frequent urination is an enlarged prostate. Sometimes it could be a diverticulum in the urinary bladder wall. So I think this is what I wanted to talk to you about. This is what I wanted to talk to you this day. And I've always said that as we share information, we're just helping to enlighten each other, just helping each other to just get enlightened and to know that when you have some of these symptoms, kindly there's help. Kindly you can be treated. We can know what is happening around your health, and you can get a solution. Thank you for always following my videos, and thank you for always liking my videos. Let us continue doing this again. Thank you. Have a great day.